Understanding déjà vu. What is déjà vu? You've likely experienced it before. A sudden, overwhelming sense that you've lived through this exact moment already. This sensation, known as déjà vu, is something that nearly everyone encounters at least once in their lifetime. But what exactly causes this eerie feeling? And could it mean something more about our brain's functionality and health? What is déjà vu? Déjà vu is a French term that translates to already seen. It's a phenomenon where you feel an intense familiarity with a situation that you know logically should not feel familiar. Picture this. You're in a conversation, or perhaps walking down a street, when you are struck by a powerful sense that you've been in this exact scenario before. It's not just a vague familiarity, but a striking and specific recognition of the moment. Yet, despite this intense familiarity, you can't pin down any actual memory of having experienced it before. The feeling of déjà vu. Dr. Vernon Neppe, a prominent researcher in the field, defined déjà vu in 1983 as a subjectively inappropriate impression of familiarity of a present experience with an undefined past. Essentially, this means that when you experience déjà vu, you're convinced that you've been through the exact same situation previously, despite knowing that this is impossible. Dr. Khoury, a neurologist, explains that déjà vu is a false sense of familiarity. It occurs when your brain creates a sensation, as if you have lived through a particular situation before, but you are unable to retrieve any actual memory of the event. This mismatch between the sense of familiarity and the logical knowledge that the situation should not feel familiar is what makes déjà vu such a perplexing experience. Causes of déjà vu. The prevailing theory about why déjà vu happens involves a miscommunication between different parts of the brain. You have two temporal lobes located on each side of your head above your temples. These lobes play a crucial role in various functions, including memory recollection, recognition of people and places, understanding language, and interpreting emotions. Within each temporal lobe is the hippocampus, which is responsible for forming and storing short-term memories. Occasionally, especially during certain types of seizures, the hippocampus and surrounding brain tissue can be activated in a way that causes you to have memory experiences like déjà vu. This activation can lead to a disruption of the recognition memory systems, creating that false sense of familiarity. Is déjà vu normal? Experiencing déjà vu occasionally is quite normal and not inherently unhealthy. It's most common among people aged 15 to 25, and the likelihood of experiencing it decreases as you age. Interestingly, déjà vu tends to happen more frequently during the evenings and weekends compared to weekdays. Several factors can make you more susceptible to déjà vu, including having a high level of education, traveling frequently, remembering your dreams, and holding liberal beliefs. Dr. Khoury notes that déjà vu is a rare phenomenon in healthy individuals, typically occurring a couple of times a year. However, if you experience it more frequently, or if it is associated with other symptoms, it might be indicative of an underlying health issue that needs to be addressed. Déjà vu and seizures. While experiencing déjà vu does not necessarily mean you are having a seizure, it can be a symptom of temporal lobe epilepsy. This type of epilepsy originates in the temporal lobe area of the brain, which includes the hippocampus and the parahippocampal gyrus. These regions are involved in memory recall and familiarity discrimination. When there's a disruption in these areas due to epilepsy, it can result in the false sensation of familiarity that characterizes déjà vu. Temporal lobe epilepsy can be accompanied by tonic-clonic seizures, which involve uncontrollable convulsions and muscle movements. Déjà vu in this context is often linked with other symptoms, such as loss of awareness, shaking, tongue biting, urine loss, and confusion after the seizure. When to be concerned. While occasional déjà vu is typically harmless, frequent occurrences, or those accompanied by other symptoms can be a cause for concern. Stress and exhaustion can contribute to déjà vu, but it can also be a sign of seizure disorders, migraines, and conditions affecting memory, such as frontotemporal dementia. People with frontotemporal dementia often experience persistent déjà vu and may try to rationalize the illusion. If you experience déjà vu frequently, or alongside other symptoms like confusion, headaches, loss of awareness, weakness, seizures, or shaking, it's essential to seek medical advice. Persistent or worrying déjà vu should not be ignored, and consulting with a healthcare provider or neurologist can help determine if there is an underlying health issue that needs to be addressed. Historical perspective on déjà vu. The concept of déjà vu is not new. St. Augustine, an ancient philosopher, referred to it as false memory in 400 AD. However, the term déjà vu was first used by French philosopher Émile Boirac in 1890. Neurologist F.L. Arnaud proposed the term's use in the scientific community during a meeting of the Société médico-psychologique. Early research suggested that déjà vu could help diagnose epilepsy, but more recent studies indicate that it might be related to perception or memory anomalies. How does déjà vu happen? One theory suggests that déjà vu occurs due to a collision between two streams of awareness: the recognition of a current situation and the simultaneous realization that this familiarity is inaccurate. This split perception might happen if someone is momentarily distracted or if their vision is obstructed, causing the brain to process the same sight twice. The second perception, experienced immediately after the first, feels unfamiliar because the first experience was only partially processed. Types of déjà vu. The sensation of déjà vu is similar across individuals with healthy brains and those with neurological conditions, but different processes occur in the brain during each type. People who experience déjà vu more regularly tend to have less gray matter, the outermost layer of the brain responsible for controlling movement, memory, and emotions. In neurological conditions, alterations in memory circuitry are observed, whereas emotional circuitry changes are seen in healthy individuals experiencing déjà vu. Who experiences déjà vu? While anyone can experience déjà vu, certain characteristics are more common among those who experience it frequently. These include having a high income, being well educated, traveling often, remembering dreams, holding liberal beliefs, and being between the ages of 15 and 25. Should you see a doctor for déjà vu? For most healthy individuals, déjà vu is harmless and infrequent. Thank you for watching. If you found this video informative, don't forget to like, share, and subscribe to InfoBurst for more intriguing insights and scientific wonders. Stay curious, and we'll see you in the next video.